have NF1 neurofibromatosis.
Wow, that could be the worst case of neurofibromatosis I've ever seen.
My mother, she also has neurofibromatosis. It was passed on to me, but for her, it is not as bad as mine.
Neurofibromatosis is a genetic condition that about half the time is passed from parent to child in an autosomal dominant fashion, meaning that if you get one of those genes from either your mother or your father, you will end up with that condition as well. Now, about half of the cases of neurofibromatosis are sporadic, where this is a mutation that sporadically occurs and there's no family history of it.
Got it from an early stage when I started secondary school. But I never believed it would have come out so much.
Some of the signs of neurofibromatosis are present at birth. You can get tiny neurofibromas that are 1 centimeter, 2 centimeters in size. Other signs of neurofibromatosis are cafe au lait spots, and these are flat patches that are light brown to tan that basically look like the color of cafe au lait. And the third thing that you can see in people who have neurofibromatosis is freckling, not necessarily of the face, but of the armpits and the groin areas.
How the leg is swollen real bad. I really can't walk on my own for too long. This weight here is giving me problems.
In neurofibromatosis, there basically is a mutation in various genes that suppress the growth of tumors. And these tumors typically grow along nerves. Now, our body is filled with trillions of nerves, and so there's a lot of places where these masses can grow. As you can see, with her, some of these masses are absolutely huge. Now, the good news with neurofibromatosis is it's very rare for these masses to turn to cancer, but they actually can in rare cases.
And by my eyes here, I had a double vision. And the tumors around my nose, they getting a little bigger, so it does give me a little problems to breathe.
If you look closely at that video and you zoom in her nose, you can see that there are masses that are basically covering her nostril openings. So breathing with all of those masses all around there could be very, very difficult and even quite uncomfortable. Gosh, I really, really hope that she gets some help for this condition.
Look up. So you're not really breathing well through your nose. There's no hole there.
As a plastic surgeon, seeing a patient like this and seeing that neurofibroma right inside her nostril blocking that nasal airway, honestly, it would take all of my power not to say, hey, look, let me numb this up for you right now and let's just snip it right off. How satisfying would that be?
Her breathing is going to become compromised. So I think it's urgent right now that we intervene at this time.
So what can you do to intervene with neurofibromatosis? Well, there's no cure for neurofibromatosis. This is a lifetime condition. In children, basically people under the age of 18, there is a medication that is FDA approved that might help with certain neurofibromas. But in an adult like her, there really is no true medication that can help with it, and you're really looking at surgery to remove those masses.
It's impossible to take all of these off because every time I take one off, you're going to lose a piece of skin.
That's the problem with neurofibromatosis. If these masses had a really small base to them, then yes, you could lop them off and then just put a few stitches in it. But the problem with this is this isn't necessarily a skin tumor, this is a nerve tumor. So it grows from deep below the skin, and that can create a fairly wide base. If you have a wide base of a mass that you remove and you cut it out, then you have basically an open wound that does not have sufficient skin to basically close it up if you don't have enough laxity on either side of it. And that's the big conundrum with some of these patients who have so many neurofibromas. Yes, it would be so satisfying to just lop all of these off, but what do you do with the open wound afterwards?
My plan is to place Charmaine under general anesthesia so we'll be able to do far more surgically. But that's going to require us to not only fit her with a breathing mask, but we're gonna have to get an IV in her.
I 100% agree with doing this under a general anesthetic. To try to numb up each of these areas before you remove it, that really would be a very, very difficult task and would be really tough for the patient who's just getting poked over and over again. But in general, to put somebody under a general anesthetic, you need to get IV access. In order to get IV access, you have to find a vein, but if there's so many tumors all around where her veins are, it could be very difficult to get that. Now, typically when you put somebody under a general anesthetic, you put an IV in, you give them medication like propofol that gets them to fall asleep really quickly. You then intubate them, putting a tube down their throat that goes basically to their lungs, and then you keep them asleep, not from the medication going through the IV, but from the gases that come through that breathing tube. Have you tried my exclusive skincare line, Youn Beauty? Our products combine natural and organic ingredients with the latest and scientifically proven anti-aging components like vitamin C, retinol, and peptides. If you're looking for healthy and youthful skin without the unnecessary chemicals, fragrances, and additives, then this is the skincare line for you. I'm so convinced that you will absolutely love my skincare products that I've instituted a 30-day money-back guarantee. Check them out at younbeauty.com and enter the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below.
Breathe. Breathe. One thread.
I could not pass the tumor.
That's really difficult because the veins oftentimes are in a similar location as the nerves, and if those nerves have grown these huge masses around them, it could be really, really hard to get that cannula to go in and cannulate that vein to create an IV. Another option is a central line. A central line is placed through one of the large blood vessels in the neck, underneath the collarbone, or in the groin. But ideally we don't go after those if we don't need to, because that's much more traumatic for the body.
Also, because she has all these tumors, they might make it impossible to really push the mask up against the skin.
As part of the induction process for general anesthesia, you usually have to put an oxygen mask on them. You aerate them through that mask for a while until everything relaxes, and then you put the tube down. But the problem here is that if you don't get an airtight seal with that mask, that oxygen could be going outside and the patient may not be actually getting it as she needs it.
And our goal right now is just to clear some of the large masses as quickly as we can so we can get a mask on her.
Oh wow, so they're actually removing these masses around her face so that they can actually get a mask on her to intubate her. Most likely he did this under a local anesthetic where he injected around where that mask would be, numb those areas up, whittle them down, and then put the mask on and then intubate. How complicated is this? This is something I have never had to deal with in my practice. Wow, that is a lot of surgery. But when you see just how many neurofibromas she has, in order to really, I think, get her where you would ideally like her to be, 60 hours, I mean, it does kind of make sense. And you also have to think that she's had those large masses, not just on her face, but all over her body. I really hand it to her surgeon to take this case on. I mean, that is a ton of work.
Life is 100% better for me. I love the way that I look now. I get the majority of the bumps off of my face.
Wow, that is amazing. You can actually see her face now, and there's no breathing issues. You can see her eyes are wide open. I mean, I am really impressed.
Before I couldn't see anything at all, like my face. But now you could naturally see my eyes, you could see my nose, I could see properly, and most important, I could breathe much better.
What an amazing result. I really hand it to her surgeon for doing a fantastic job. I mean, this is what makes medicine worthwhile, and especially being a surgeon. There's no way to get this type of result if you don't operate on that patient, and really taking the time and the effort to do that. I mean, what an amazing result. Now, she has a ton of neurofibromas, but what about a guy who has literally a 70-pound tumor hanging from his face? Yes, 70 pounds hanging from his face. How do the surgeons get rid of that? You gotta see this story. I've got a reaction to it right up here. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.